What's up, guys? Welcome back to this week's episode of Worth the Wait. I am so incredibly excited for the guest that we have today. We are going to be talking all things skin. And if you've been listening to the podcast for a long time, you know I've shared my own personal journey with my skin. So I am so excited to have Dr. Kemmy here today to talk to us about skin and to also particularly talk to us about skin in people of color, melanated skin, which we can see she has beautiful skin if you are watching this episode of our podcast. So Dr. Kemmy, thank you so much for being here. Why don't you introduce yourself to the audience and tell them a little bit about yourself?
All right. Well, thank you so much for the opportunity to be in the podcast. I really enjoyed listening to it, and there's so much valuable information provided. So I'm Dr. Kemmy. I'm a board certified dermatologist. I'm also an author of the book, Live and Look Younger. It's right here. And I'm pretty much a dermatologist with 10 years of experience. I work at Complete Dermatology in Houston. And currently I do medical, surgical, and cosmetic dermatology. You can probably tell that I have an accent just by listening to me. So I'm originally from Kenya. I grew up in Nairobi and I moved to the States in 2001. Pretty much spent 9 years in Connecticut at Yale doing my undergrad training, a master's and medical school. And then I did a year in Boston, did 3 years of dermatology training in San Francisco, lived in Connecticut for 6 years, and now I'm based in Houston. So hopefully I won't be moving anymore. I've moved about a lot, but in my experience, I've been to many parts of the country. As a general dermatologist, I get to see a lot of people, and I have the honor of being a dermatologist of color and seeing a lot of patients of color. In the US, just about 3% of dermatologists are African American, and so we get to see a lot of our people and to treat their conditions.
Wow. Well, that is quite the resume. I have to say that you are like the epitome of Black girl magic. So that makes me even more excited to have you here as a guest, and especially for you to take some time out of your incredibly busy schedule to be here with us.
Thank you.
I want to know, now this is kind of a selfish way to start, I must admit. But if you've been following my story, and this is to the listeners, you guys know that I've lost 100 pounds 10 years ago. But before I did that, I had some issues with my skin. Now, pre-weight gain, I always had pretty decently smooth skin that I feel like I inherited from my mom. So thank you, Mom. However, once I started to gain the weight, I started to get these dark, leathery patches on my neck, and then it spread to my eyelids. It was all over my knuckles. And it was to the point where I didn't look like myself. My skin tone had literally changed from being the way that it is now to just a darker overall skin tone. And I went to see a dermatologist because, you know, at the time I was in college and I'm thinking, whatever this is on my skin, like I need some cream and I'll just put that on my face and be done. And luckily she had a keen eye and she said, I think you need to go and see your primary care doctor. And I'm going, what? I'm like, well, can you give me anything in the meantime? You know, I'm thinking it's just skin. And so I go and see my primary care, and sure enough, my results come back and I am pre-diabetic. So I find out that it was insulin resistance that was causing this, and a condition that's known as acanthosis. So can you tell us a little bit about your experience with acanthosis and how it relates to insulin resistance?
Absolutely. Well, thanks for sharing your story. Acanthosis is actually a pretty common problem. In the US, it's estimated that it affects about 13% of African Americans. And then Native Americans actually have the highest incidence. One of the studies found that about 34% of them have it. And different ethnic groups are affected differently. So Latinos, about 5 to 6% of them have it, and less than 1% of Caucasians have it. So definitely the more melanin we have, the more you're likely to get acanthosis nigricans. But it's pretty much this condition that affects the skin where the skin becomes darker and thicker, especially in skin folds. So for example, the back of the neck, the axilla or the armpits, under the breast, in that inframammary area, the groin area, those are the most commonly affected areas. But just like in your case where it's spread to the face and spread to the eyelids and other parts of the body, it can certainly spread, even though we see it a lot more commonly in the skin folds, so the back of the neck, the armpits, the groin area, but it can be more generalized. So we still don't fully 100% know what causes it, but we know it has several associations. So by far, for most people who have it, most of them will have either diabetes or they'll have insulin resistance. So that's the most common presentation. And then, so when it comes to insulin, we know that insulin can cross the epidermal junction in the skin. The dermis is the middle layer of the skin and the epidermis is the top layer. So when there's excessive insulin, it can actually cross over, get to the top layer of the skin. And then we have insulin growth factor receptors on the skin, on the layers of the skin called keratinocytes. And when insulin binds those receptors, it makes those keratinocytes, those are the skin cells, it makes them overproduce themselves. So when they overproduce themselves, the skin becomes thick. And because the keratinocytes are near melanocytes, which are our pigment-producing cells, in the process of thickening, there's also more melanin, and that's why the areas get darker. So that's one of the mechanisms. And for the most part, most people who have acanthosis, again, will have diabetes or insulin resistance, but not everyone. So there are other hormonal disorders that can cause it. There are also medications that can cause acanthosis nigricans. So for example, if people have been on systemic steroids, some people can get it. Some people who've been on oral contraceptive medications can get it. And then there's also a list of other medications that I won't go through, but there are other medicines that can cause it. There are also people who have autoimmune disorders like lupus, Sjogren's syndrome, Hashimoto's thyroidosis. They can also get it because of their autoimmune disorders. And then also very, very rarely, but very importantly, sometimes when people have an internal malignancy, a cancer, for example, GI tumors, they can also get acanthosis nigricans. The ones who have cancer usually get it when they're middle-aged, and it will usually come very quickly, as opposed to the acanthosis that we see more commonly that comes really slowly. So there are many causes, and that it's important to see your dermatologist or another physician so that you can have testing done just to make sure, because sometimes people think, oh, it's just because I'm overweight and it's because I have insulin resistance, but because there are many other causes, it's important to know exactly what we're dealing with.
Yeah, wow. I'm glad that you touched on the other cases that could be causing someone to have acanthosis, because I do think, for one, I think it wasn't really well known 10 years ago when it was happening with me. I think people are becoming more aware now, but I certainly don't think people are realizing that there can be other hormonal imbalances and even something as big as cancer that could be an underlying factor to this. So I appreciate you bringing that to light. Something that you had mentioned was about the insulin and how you kind of mentioned the entire inner workings of how something like this could happen, which I really appreciate, because I didn't ever really sit down and kind of think about, well, how does this impact the skin? So you said that it goes from the derma layer of the skin, right? Which is like the middle layer. I'm trying to get this right.
Yes,
and
that's real.
Okay. No, go ahead. Tell us.
So there are three layers of the skin. The epidermis is the very top. It's what we see. The dermis is in the middle. The dermis has a lot of blood vessels. And so hormones like insulin, are contained in the blood vessels, but they can, when there's an excess of insulin, they can come out of the vessels, get into the skin. And then when they cross from the dermis to the epidermis and then affect those insulin like receptor growth factors on the epidermis, that's the top layer of the skin. They can make the top layer of the skin overproduce itself. And so that's why we see that thick skin, because it's just overproduction. And then usually we see more of that in the skin folds. And part of it is because there's a lot more friction in the skin folds. So we think that a lot of the overproduction will happen there just because the friction also stimulates overproduction of the skin.
Yeah, that makes a ton of sense, especially when I think about what I was experiencing specifically on my eyelids. And at the time, I was trying to still wear, eyeshadow and things like that. And of course, that was further irritating it. So that makes a lot of sense.
Right.
Now, you've told us about some conditions that could be cause or could be a cause of the acanthosis. But can you tell us about some other skin conditions that might be confused with acanthosis because maybe they look similar or present similar symptoms?
Absolutely. So there are many. One of them, the most common, is post-inflammatory hyperpigmentation. So whenever the skin is injured or has inflammation, it can have hyperpigmentation as a result of that. So for example, I think for your eyelids, for example, you mentioned you're putting makeup and stuff that might have been irritating your skin, and you may have also had an irritant dermatitis, and as a response to that, you got post-inflammatory hyperpigmentation. So sometimes that can be confused because also in the armpits, people can use deodorants and other things that are irritating, and that can cause the redness and the post-inflammatory hyperpigmentation. Or even on the neck, if they're allergic, if there are collars that rub the neck, they can have post-inflammatory hyperpigmentation. So sometimes the two can be confused. But then the difference is with the post-inflammatory hyperpigmentation, usually there's a lot of darkening, but you don't have that thickening of the skin and that velvet-like texture that we see in acanthosis nigricans. So that's one way we can tell. And then, of course, that history of the rash or the injury before the post-inflammatory hyperpigmentation. And then other things that can also be confused, there is a fungal condition called tinea versicolor that can make the skin have patches that look darker or sometimes lighter. But then when people have it on their back or the backs of their necks, they can think it's acanthosis. But again, the skin is much thinner with tinea versicolor, and we usually see some scaling. And then, melasma usually affects the face, but it can also affect the neck. And so sometimes people confuse them. But again, the melasma looks quite different and the skin is not as thick. And then there's also a rare condition called Addison's disease, where the adrenal glands are not producing enough hormones, and it can cause many symptoms, including darkening of the skin. With Addison's disease, though, there's more all over darkening, not really the skin folds and the areas of friction that we more commonly see with acanthosis nigricans. Okay. And then there's also one other condition called CARP that's rare, that we see a lot in young women. And usually you'll also have a net-like pattern of hyperpigmentation that can affect the chest and the back that sometimes can be confused with acanthosis.
Wow. I had no idea that there were so many different conditions that could present in a similar way. I understand that the differentiating factor is, of course, the leatheriness that kind of comes with the acanthosis. But it sounds like with all of those conditions, there's clearly like an irritant, and there's like, we don't want to further irritate it. And I think something that I thought, I don't know if other people think this, but when I saw and noticed the patches on my skin, I started to like scrub them. Because you think, oh my gosh, like, what is this? Sometimes you can even think it's just like a buildup of product or something. Do you tend to see that in your office where people come in and they're like, I've tried to scrub this off and it's not coming off?
Absolutely. Especially for a teenager. So one of the biggest misconceptions is that people think it's dirty skin. So I've seen a lot of mothers who come, especially with their sons, and they're mad with them. They're like, this guy is not showering enough, not cleaning well enough. The back of the neck is always dirty, and it's not a hygiene thing. It's just because the person has acanthosis nigricans. So that's one of the biggest misconceptions, that it's caused by poor hygiene. And then unfortunately, scrubbing and irritating, that only stimulates the skin cells to produce more skin, and it makes the problem even worse.
Yeah, I definitely experienced that. So I can vouch for that. So can you tell us, as a dermatologist, are you able to assist at all with acanthosis, or is this something that has to be addressed by a medical doctor who is going to, maybe do some sort of hormonal treatment or insulin or something like that?
So I think acanthosis is one of those conditions that needs a multidisciplinary approach, which means many different providers. So for sure, dermatologists can tell the difference. And sometimes when it's confusing, we can tell the difference where we're like, this is not acanthosis, this is CARP, or this is something else. So for the initial diagnosis, going to a dermatologist is important. And then for the management, so the most important thing in management is losing weight. especially for people who have it due to insulin resistance. It's losing weight and watching lifestyle changes like diet modification and exercise. But there are also things that dermatologists can prescribe to help it. So because weight loss, again, won't be rapid in most people. It's a slow, steady process, especially if you do the lifestyle changes as opposed to bariatric surgery or the Ozempic that people are taking a lot right now. But there are things we can do to help along the way. We can give topical medications like retinoids to help it out. We can give vitamin D creams. There are also some keratolytic creams that help to shed off excessive layers of skin, like salicylic acid and lactic acid. So we can offer those. For some people, we give oral medications like retinoids. For other people, we'll give medications like metformin to just reduce insulin, to just help with the insulin resistance. We can do some chemical peels to help get rid of the excessive skin. And then there are also select lasers that can be carefully used to help out. I'd say despite all the treatments we have, the most important thing is addressing the main cause. So once we figure out what the cause is, whether it's insulin resistance or an autoimmune disease or a medication, if we can get to the cause and we handle that, it solves the cosmetic issues.
Right. Wow. It's good to know because I didn't realize that there was any treatment from the dermatologist standpoint. And I think that's good to know because if you're going through the process and you're trying to be more healthy and you're making lifestyle changes, that doesn't mean that you don't want to aesthetically present well. And so if there's something that's covering your face, it may be causing you, discomfort or causing you to be less social. I know that's the impact that it had on me. So if I had known that there was, again, like you said, a multidisciplinary way to treat it, then I definitely would have gone that route. So I appreciate you saying that.
Right.
I want to kind of switch gears and talk about people of color in particular, which you talked about during your introduction. I know that at the time when this was happening for me, I was a student, I was in college. I didn't have access to the best healthcare, so that was another thing. What are some challenges that you've noticed in your field that people of color face whenever they are seeking treatment from a dermatologist?
So there are many challenges. One of them could just be lack of access to dermatologists. And this lack of access affects everybody, but sometimes it can even be worse for people of color, especially when they're seeking a dermatologist of color, either because they want somebody who will understand the differences in the skin and the cultural differences. But overall, there's a shortage of dermatologists in the US. And then the ones who are really skilled in treating skin of color or who want to do it, there's even a smaller number of them. And so it's harder to get access to care. And then sometimes it's hard to find somebody nearby. Sometimes you find someone, but they just don't take your insurance. So there are many factors that come into things. And some people just have to pay cash because the dermatologists they find are not in their network. And it's really tricky. So that's one of the biggest issues, just the lack of access. And sometimes people don't even know that they should look. Another issue that they find is that sometimes there's just lack of cultural competence. So even though dermatologists all over are trained to treat all skin tones, but not knocking down states like Wisconsin or the Dakotas, but there's some certain places where in your training, where some dermatologists just don't get enough patients of color to be very comfortable treating skin of color. And so some of them, even though they've learned about it in the textbook or had a few examples, they have not seen it enough to fully understand the cultural differences and to be comfortable doing it. And so, most dermatologists of color like me will seek out educational opportunities. We will go to conferences and learn, but then other people won't necessarily do that. And so sometimes people just have a hard time finding a dermatologist who is interested and and good at doing that. And again, the lack of representation may play a role because, as I said earlier, only 3% of dermatologists are African American. And of course, more than 10% of the population is African American. So there's that mismatch already going on.
Yeah, absolutely. So from your vantage point, would you say that there's any way that people of color can really advocate for themselves in this space and for that care if they're maybe, going to see a dermatologist who, again, is not culturally competent, but this may be their only option because maybe there are no other dermatologists that accept their insurance or that's in their area. How would they navigate that?
So absolutely, I'd say go and see a dermatologist. When you do go to see a dermatologist, in many dermatology offices, sometimes they have MDs, the doctors themselves, or other times they're nurse practitioners and PAs. I would say if you're a patient of color, try your best to actually see the dermatologist, the doctor, because there's a certain minimum requirement in the training. After medical school, dermatologists will go through 3 years of residency. We have to go through several textbooks, do exams. So even though your dermatologist may not have had as much experience in person with patients of color, they definitely have learned about it, and they're more likely to help out than maybe their NP who just learned about dermatology for 2 or 3 months before seeing patients on their own. So you'll want to see the MD. That's the number one thing. Try your best to see the doctor. And then also, be prepared for your appointment. It's really important to have a list of the medications you've taken, the topicals you've taken. Just know what you've done, because sometimes people go to visits and they don't know what medicines have tried. They don't remember details. When you don't have the details, you get very generic care. The more prepared you are, the better the care you have. Then if you know your diagnosis already, or if you had the first visit and they tell you have this diagnosis, I'd recommend reading about it and learning about it, so that when you go for your follow-up visit, if there are questions you didn't ask in the initial visit, you can now ask them later on. I also recommend maybe joining supportive communities. So for example, there are conditions like psoriasis and eczema and even acanthosis. For every condition that people have where there are many challenges, there's usually an online forum or a support group where you can get advice. People can share their experiences. So I would recommend joining one of those, because to be honest, dermatology visits are usually brief because there's so many patients to see. And sometimes you'll be told something very briefly, but when you go to the online support group, so when you go online to educate yourself, you'll get the full, more details, so you'll know. And then also just say, educate yourself for sure, and then be your own advocate, ask questions, and don't be scared to ask questions. And honestly, if you find that your dermatologist is not serving you, look for another one.
Period. Because that's truly what's needed. Is we need to be empowered to know that we can change our provider. I think sometimes we feel like, this is the person, so we've got to stick with this person, but we should be, empowered, especially as people of color, to go out there and to search for different support if we're not getting the things that we need. And I really appreciate all of the tips that you gave, especially about being prepared when you come into the office, making sure that you've done your own research. And I think that this bit of information and this tip is going to help not just when someone's seeking a dermatologist, but any medical care provider, to just
Absolutely.
make sure that you're prepared. Yeah. So I really, really appreciate you sharing that.
Absolutely. And I always say, come with a list of questions. If you go with a list of questions, have the most important. And when we say go with a list of questions, don't go with 30 questions. You'll irritate people. Think of your most important questions and maybe have a list of 5 or 6 questions. If you have a reasonable amount, it's good. If you have too many, it makes the visit drawn out. And sometimes you'll get really quick answers just because the doctor wants to move the visit along. So there is a balance, but definitely go with some questions and do research so that your questions can be more specific to you, and they can be smarter questions that will be more helpful.
Right. Okay. So I want to move on to talk about another condition that I've experienced. I feel like I've experienced all of the conditions that us melanated people tend to have, but that is keloids. So thinking about conditions like keloids or hyperpigmentation, would you say that there are any specific challenges when dealing with those particular skin conditions?
So let's talk about keloids. So for keloids, people of color are more likely to experience them than other people. And it's not sure why, but I think but one of the reasons is that we think that the types of collagen that people with more melanin have is just more prone to the keloid response. So the collagen is useful. It makes people age more slowly. But then on the flip side, whenever there's trauma, whether it's a cut, whether it's acne, the keloids can form. Keloids in general are just tricky to treat, period. The treatment options are not very many. For the most part, we do injected steroid. We'll inject them with steroids. Sometimes we'll do cryotherapy where we freeze the keloid first and then inject it with steroids. There's radiation therapy that can be done. We like using silicone sheets for them. There are many treatment modalities, but the challenge is keloids are hard to treat. They require many treatments. And then some of these treatments that we do, like the cryotherapy where we freeze them before injecting, unfortunately, that can kill the melanocytes, the pigment-producing cells above the keloid. And so, yes, you'll flatten your keloid, but then it'll have a different color. So it's still quite challenging to treat keloids. Radiation therapy is a very effective way of treating them for some of them, but it's not very common to find doctors' offices that have them. So, for example, my office doesn't have them, and I treat people with keloids, and I do the best with what I have, but not all the treatment modalities will be available where you go. And it can be a bit of a challenge to treat them, honestly, especially because sometimes people wait until the keloid is very well developed. It's been there for a long time, and it'll need many rounds of treatment.
Wow. So do you guys still offer the option to, like, I believe this was maybe 15 years ago that I had a keloid on the back of my ear that came after a piercing. Mm-hmm. A second piercing. And so it started off small and just grew and grew and grew. And mine was actually lasered off, if I'm not mistaken. So is that still a form of treatment that you all do?
Absolutely. It can be lasered off. It can be cut off. But usually after that treatment is done, we'll also do more. So when I cut them off, I always inject whatever is left behind with steroids so that a new keloid doesn't form. And then I'll also usually tell people to put a silicone sheet or to use some sort of silicone and also pressure. I'll use multiple modalities to prevent a new one from coming again.
Okay. So selfish question. If I wanted to go and get my second piercing back, I am taking a risk there that it could develop again. Okay.
Absolutely. I probably wouldn't, because the fact that you've developed one keloid, it just shows you that the skin around your ears is just very keloid prone, and it's probably going to do it again. It's okay. You can do the fake clip-on earrings and stuff.
Yeah. I'll have to do a fake second hole.
Yes.
So I know that when we're thinking about us as people of color, a lot of the times when we think about things like sunscreen or sun protection, it's not something that necessarily comes front of mind. We always think about our melanin. We know that it's a protective layer, so we feel that it is protecting us. But how important is it for us as people of color to ensure that we're using sunscreen?
So it's really important. As you said, melanin is amazing. It has antioxidant properties that keep the skin young, melanin absorbs UV radiation when it comes to hit the skin, and it prevents the UV rays from damaging the skin and causing DNA damage that then leads to skin cancers. So melanin does have its advantages and it's helpful, but it needs help. Melanin is at the top layer of the skin. So it's in the epidermis, but then there's still the middle layer of the skin called the dermis. And there are some rays, the UVA rays, the ones that age us, they're still able to penetrate into the dermis, and melanin alone is not enough to protect you from UVA rays. So when people of color are exposed to the sun, you may not get the sunburns because your melanin is protecting you from that, but those UVA rays are still getting in and they're damaging the collagen. And then later on in life, the wrinkles and the sagging skin will develop because of that damage. So you won't see it happening. You probably will never have a sunburn, but just know that the UV radiation is causing that damage. The UV radiation also causes hyperpigmentation. And so we see it a lot, like especially in older people, my mom's generation that never used sunscreen, they have this thing called maturational dyschromia, where after years and years of unprotected sun exposure, the skin just starts getting its sunspots, its dark spots, the hyperpigmentation and the irregularity that's really, really hard to control. true. Some people will get melasma due to the sun protection, so due to not protecting from the sun, and then all hormonal changes. But in general, for people of color, usually skin cancers won't be a concern, even though they will affect people of color. They don't affect them as much. There won't be a concern. It's the discoloration that will be the biggest concern. And then also the premature aging that comes from the UV rays damaging the collagen. But I also still want to make it clear that people of color still get skin cancers, and especially if you are immunosuppressed. So say, for example, you've had like a kidney transplant or some other transplant and you're on medications to keep you from rejecting your kidney, you're chronically immunosuppressed. I've seen many skin cancers in people of color because of that. And then also time, as people get older, they'll still get skin cancers. I had a very cute 90-year-old African-American patient who got a skin cancer just because she lived long enough and her melanin had done its job, but eventually she still got the skin cancer. So people of color still need to use sunscreen every day, 365 or 366 days a year.
Okay, Dr. Kemmy. So if we must use sunscreen, then can you help us, right? Because I don't know about anyone else, but if I've tried to, have a beach day and just went to the local pharmacy and picked up a random sunscreen with the best SPF and we put it on, we all know we end up with that ashy, kind of overly white and gray kind of look. So are there any particular products, whether it be for sun protection or just other dermatological uses, that we should be looking for as people of color specifically?
So there are two types of sunscreens. There are sunscreens that we call physical sunscreens. Those ones will mostly have zinc oxide and titanium dioxide. And unfortunately, it's the zinc and the titanium ones that tend to have that whitish discoloration because they're physical and those molecules are whitish. So ways you can get around that, you could try to get one that has nanoparticles that's more sheer. So it will still have the zinc oxide and the titanium dioxide, but because the particles of the zinc and the titanium are smaller, it will blend in a little bit better with the skin. Another tip that some people have been given is mixing the sunscreen with your foundation if you wear foundation, and then that way it will blend a little bit better. Another thing you could do is just not do the physical sunscreens and then go for the chemical sunscreens. So the chemical sunscreens work differently. The physical sunscreens form a shield in front of the skin that whenever the UV rays come, they block them or they prevent them from getting in. The chemical sunscreens work a little bit differently. When they get into the skin, they kind of incorporate in the skin, and whenever the sun rays come, the chemical sunscreens will just hold on to they'll disperse or diffuse that UV radiation. So the chemical sunscreens, they blend a lot more beautifully. And so I'd say you could consider a chemical sunscreen and not a physical sunscreen. And that way you'd be more protected. However, in children, we recommend physical sunscreens because they're more elegant. For children, I just say just rub it in well. Make sure you're putting it on moisturized skin so that it doesn't look as ashy. And then you can get a tinted one. There's some tinted physical sunscreens that actually tend to blend a little bit better. So it's a matter of trial and error until you find the one that works for you.
Okay, well, very well. There's hope for us to get some really good sun protection.
But there is hope. And my challenge for myself this summer, I'm going to be trying out different sunscreens on myself, on my children, my husband. We have different shades of brown. So I'll be trying out the sunscreens so that I can give recommendations of the ones that have worked better for me and my family, because it's a question I get asked all the time, which ones people should use, especially for people who want to use the physical sunscreens and want to avoid the chemical ones. So it's something I'll do and kind of come up with my list of the ones that blended the best. So something I will definitely do this summer.
Awesome. Well, I hope you will take us on your journey, maybe on social media, so that we can kind of follow through, see what your recommendations are, see how your husband and the kids like the sunscreens that they try. So why don't you tell our audience where they can find you and how they can keep up with Dr. Kemmy?
So if ways to find me, you can find me on Instagram and Facebook at the handle at Dr. Kemmy MD. So that's DrKemmymd. You'll find me on Instagram and on Facebook. Another way you can keep up, I wrote a book called Live and Look Younger, and it's a nice comprehensive book that just goes into ways we can stay younger. It will talk about skincare. It will talk about sunscreen. Actually, you learn a lot about sunscreen here and the ingredients that dermatologists love, like retinoids, niacinamide, vitamin C. It will talk about diet and sleep, exercise, all those things that we have to do. It's a more comprehensive approach to looking younger. So I definitely recommend grabbing the book. And, if you have questions or comments, do find me. You can also find me on my website, www.drkemmymd.com.
Very well. I'm going to have to go and pick up that book. I hope you ship internationally because I want my copy.
Absolutely. Where are you? Where are you?
I'm in Mexico.
Oh, fun.
Yeah. I've been out here for about a year. So it's a whole different way of living and I'm really enjoying it.
Oh, that's exciting. Yes, I do ship internationally and it's also available on Amazon, but I will ship it to you if you get it from my website and I'll autograph it and ship it. So happy to do that.
Thank you so much. I'm going to put it right up on my bookshelf in my new office. I'm so excited. Well, thank you so much again, Dr. Kemmy, just for being here and for taking the time and for helping us and informing our audience, who is, mostly people of color, about what we can do to get beautiful skin. We certainly know that we can trust your word because you are absolutely glowing. So thank you so much again. And we wish you the best of luck and success with your book and with your office, which is in Houston, right?
Yes, I work at Complete Dermatology in Houston, and I am very happy to take patients, everyone. And I see a lot of patients of color. So if you're in the Houston area, definitely come and see me. And then again, Cookie, thank you for the work that you're doing. You really have a great podcast. Being overweight, there's so many skincare problems that come with it. It's not just acanthosis, but people will get into trigo. They're more likely to get infections. The psoriasis gets worse. Hidradenitis is a problem we didn't really talk about, but it's a big, big deal. And we see it a lot in patients of color. And it is also associated with being overweight. So I just thank you for the work you're doing to help people lose weight and just lead a healthier lifestyle. It will definitely lead to better skin and just better quality of life overall. So people listen to her and do what she says you should do. Really, let's all make these lifestyle changes together, not only to look good, but to feel good and to have a more vibrant life where we're more confident and where we're happier. Thanks for what you're doing.
Absolutely. Thank you so much, Dr. Kemmy. Well, thank you guys so much for listening to this week's episode of Worth the Wait. Don't forget to check out Dr. Kemmy on IG, on Facebook, on her website. Pick up a copy of her book, and I will talk to you guys next week. Bye.
Thanks. Bye-bye.